Before you start taking Xenazine, make sure to read the medication guide provided by your pharmacist. If you have any questions, consult your doctor or pharmacist. Take Xenazine by mouth with or without food as directed by your doctor, usually once a day in the morning when you first start treatment. Your doctor may gradually increase your dose to 2 or 3 times a day over several weeks. A slow increase in your dose will help your doctor find the best dose for you while keeping side effects as low as possible. The dosage of Xenazine is based on your medical condition, response to treatment, and other medications you may be taking. Make sure to tell your doctor and pharmacist about all the products you use. It's important to take Xenazine regularly to get the most benefit from it. To help you remember, take it at the same times each day. If you stop taking Xenazine for several days and then start taking it again, you may need to slowly increase your dose until you reach the regular dose you had been taking. Follow your doctor's directions on how to restart treatment. Make sure to tell your doctor if your uncontrolled movements do not improve or if they worsen. Some common side effects of Xenazine may include drowsiness, trouble sleeping, tiredness, dizziness, nausea, and vomiting. If these effects persist or worsen, notify your doctor. Your doctor may need to adjust your dose to reduce these side effects. To lower the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. In some cases, Xenazine can cause side effects that are similar to the symptoms of worsening Huntington's disease. Your doctor may need to adjust your dose to determine if these side effects are due to the drug or the disease. Contact your doctor immediately if you experience serious side effects such as changes in mood, Parkinson's disease symptoms, trouble swallowing, or restlessness. If you experience signs of increased prolactin hormone or symptoms of neuroleptic malignant syndrome, seek medical help immediately. A serious allergic reaction to Xenazine is rare, but if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects and report any side effects to the appropriate regulatory authority. Before taking Xenazine, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any inactive ingredients that could cause allergic reactions. You should also discuss your medical history, especially if you have had breast cancer, liver problems, or certain heart issues. Xenazine may cause dizziness or drowsiness, and using alcohol or marijuana can make these effects worse. It's important to avoid driving or using machinery until you know how this medication affects you. You should also limit alcoholic beverages and discuss your marijuana use with your doctor. If you are planning to have surgery, make sure to tell your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Xenazine should only be used if clearly needed, and you should discuss the risks and benefits with your doctor. It's also important to consult your doctor before using Xenazine if you are breastfeeding. When taking Xenazine, it's important to be aware of potential drug interactions that could affect how the medication works or increase your risk for serious side effects. Some products that may interact with Xenazine include valbenazine, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial to avoid taking MAO inhibitors, such as isocarboxazid, linezolid, and selegiline, with Xenazine as it may cause a serious and possibly fatal drug interaction. Your doctor can advise you on when to start or stop taking this medication in relation to MAO inhibitors. Additionally, it's important not to use medications containing deutetrabenazine while using Xenazine, as tetrabenazine and deutetrabenazine are very similar. Always follow your doctor's guidance and never start, stop, or change the dosage of any medicines without their approval. If someone has taken too much Xenazine and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or a local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Symptoms of an overdose may include muscle stiffness or pain, fixed upward position of the eyeballs, sweating, dizziness, and severe drowsiness. It's important to remember not to share Xenazine with others. Your doctor may also require you to undergo lab or medical tests while taking this medication, so be sure to keep all of your medical and lab appointments. If you have any questions, make sure to consult your doctor for more details. If you forget to take a dose of Xenazine, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. It's important to store Xenazine at room temperature, away from light and moisture. Avoid keeping it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Xenazine, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.